Hi, Dr. Craig Rundbaken, talking to you from Phoenix, Arizona. I want to talk to you today about valley fever signs and symptoms. Some call Phoenix Valley of the Sun. I tend to think of it as Valley of the Spore because we have this growing epidemic fungal disease called valley fever, also known as coccidiomycosis. Two species are known, coccidiomycosis immitis as well as coccidiomycosis postidacea. So once the spore from the desert floor is inhaled by a human or an animal, symptoms can occur. So in a human we can get fever, chills, night sweats, joint pain, muscle aches or myalgias, arthralgias. Sometimes you get inflammation of the eye called conjunctivitis. Often people get chest pain and coughing, pleurisy, coughing up of blood, often related to a lung cavity they have. The most profound symptom is fatigue. Fatigue seems to be the symptom that lasts the longest with valley fever in all people. Arizona Department of Public Health did a study a few years ago, and they found that most people of those who contracted valley fever and became ill with it, and again that's about 40% of the people that actually inhale the spore become ill with it, missed an average of a month of work. And about 75% were unable to get back to their usual activities for 3 months. They didn't feel completely normal again for about 6 months. Everybody's different with this disease. Some people get better in a few weeks, and some it could take up to 6 months to feel improved. Although many of us here in the endemic area where valley fever exists have many patients that have been on treatment or antifungal medication for well over a year for a variety of reasons, which we'll talk about on future videos. But next I want to talk to you about some of the rashes that we see with valley fever. The most common rash that I see with valley fever is known as erythema nodosum. Two others include erythema multiforme and another rash called toxic erythema. The rashes with valley fever usually are good prognostic signs. So that means that the individual is creating and generating antibodies to fight this infection. It doesn't mean that the fungus has gone to the skin, although that is certainly possible. It's usually a rash that will last 1 to 3 weeks and usually dissipates and fades away. Particularly with erythema nodosum, you'll see inflammation and redness, bumps on the shin, and sometimes in other parts of the body. The shins are the most common. You have inflammation of the fatty tissue just under the surface of the skin. These nodules that form, again, mostly red, but they can form a purplish hue. They tend to fade over a couple of weeks. Can really cause some pain. So some people want to take anti-inflammatory medication for these, such as NSAIDs, such as Motrin, Advil, or Aleve. Some people have prescribed colchicine among other medication, but it's really not required. These will dissipate and go away on their own. So another rash we see with valley fever is erythema multiforme, and you can see these red target-like lesions. They can be on the back or on the anterior thorax. They can be on the thighs. Can be hive-like, itchy, red, and inflamed. And again, they form these target-like lesions, often symmetric as well. One of the clinical concerns with these two particular rashes is often people will show up to a same-day care, their physician, or emergency department with an upper respiratory tract infection. They'll be given an antibiotic, go home, and sometimes a few days later will develop a rash. They go back to the ER, and immediately the rashes, erythema nodosum and erythema multiforme, are blamed on an acute allergic reaction to the antibiotic without ever considering valley fever. So it's very important, if you're in an endemic area where the coccidiomycosis fungus exists, if you have the rash of erythema nodosum or erythema multiforme, first and foremost in our minds needs to be valley fever. An antibiotic won't treat valley fever. We need to treat valley fever with antifungal medication. One key point I do want to mention about these two rashes, erythema nodosum and erythema multiforme, is that these rashes do occur in other illnesses. We've seen these rashes with sarcoidosis, inflammatory bowel disease, pregnancy, drug reactions, strep infections, cat scratch disease, Behçet's disease. So there's a variety of diseases where erythema nodosum, erythema multiforme can be seen. But if your patient's in the endemic area and sick with a respiratory infection, first and foremost we have to consider coccidioidomycosis or valley fever. One other rash that we can see with valley fever is toxic erythema. I don't see this rash as often. It's more related to the fever that you get with valley fever than a hypersensitivity, allergic reaction, immune response that you get with erythema nodosum or erythema multiforme. This usually dissipates in about a week, and it's red, inflamed, scaly, and sometimes itchy. You can see it with certainly any other infections, any other fever-associated illness. But again, this is different than the other two rashes, as we're not reacting directly to the fungus with a hypersensitivity, allergic type reaction. It's more related to the fever.